This was kind of exposing that for the very first time. Some of you guys remember this, and there's some other articles in Time and a few other magazines basically saying for many people these drugs may not do any good. And what we want to pay attention to is, why is that? And how do they actually work? What does a statin drug really do, right? How does it block that? And so what this does is it inhibits a vital enzyme in the manufacture of cholesterol. So I was going to show you how that works with some nice biochemical equation, but I figured that wouldn't do any good. Unless you're someone who really pays attention to that, probably wouldn't make a lot of sense. So basically what we want to pay attention to is there's a normal process that's created for a reason in your body. Your body never does anything to hurt you. It only does things to help you. Right? So when something happens that stimulates the production of cholesterol, that's a good thing. And so what this does is it blocks one of those pathways, so it doesn't happen anymore. And it prevents the production of cholesterol in your body. But why is that a problem? Well, here's one reason. Your brain is made up of 60% cholesterol. And so if you're not getting the cholesterol, your neurological and your brain tissue can actually deteriorate, which can lead to things like depression, because your serotonin starts to go down. And so now we're having depression issues. What does that lead to? Another medication, exactly, or more problems. Now you look at another issue, CoQ10. Who's heard of CoQ10 before? A number of people. If you're on statin drugs, you may have heard of it, hopefully. This is an antioxidant which actually helps transfer energy in our cells. A very important coenzyme, vital to success in life in your body. Now what happens when you take statin drugs, part of this same process that creates cholesterol, CoQ10 is in there. So if we're blocking the production of this cholesterol, we're actually blocking the production of this CoQ10 and a few other things too, which actually helps reduce inflammation. And you're going to learn inflammation is a real cause of heart disease. So this is actually helping prevent heart disease and protects you from cancer and aging. And it's the primary building block for the cells of your brain and your nervous system. So if you're taking statin drugs right now, you absolutely have to be supplementing with this, or you're creating a whole new set of problems. Very, very important. So if you know anybody who's taking something like this right now, make sure that they're supplementing with CoQ10 immediately, because that's going to make a huge, huge difference in their life and their function. Because here's some potential dangers that also exist. Right? When you're messing with the liver and the way it produces things, you can cause liver damage. You can cause neuropathy issues because they're messing now with the nervous system. You can cause muscle problems, muscle wasting and atrophy. And this very same study goes on to talk about the same thing. Let's see if I highlighted it in here. Yep, here it is. And so when we're doing that same thing and we're actually reducing the cholesterol, it doesn't change anything. It can actually stimulate atherosclerosis and heart failure. And one of the things that it interferes with is selenium and proteins. Selenium is another important mineral and enzyme for proteins in your body. And proteins make up just about everything. So when you block this, it's basically like pouring gasoline on the fire of inflammation and free radicals, which damages muscle tissue. That's exactly what's happening. That's how it creates muscle wasting and atrophy. We already talked about depression and how it stops CoQ10, and actually can cause heart failure and increased risk in cancer.